Good evening, everyone. Welcome to the webinar series called Wildlife Chronicles, organized by Center for Wildlife Studies. Our topic for the day is Beyond COVID-19, Understanding One Health in India. We have a group of scientists who have been working in the field of ecology, genetics, and public health. I'm Anusha Chaudhary. I'll be moderating this discussion. I'm a research fellow at Center for Wildlife Studies, and I have a master's degree in biodiversity and conservation from Guru Gobind Singh Indraprasth University in Delhi. I'm interested in disease epidemiology, public health, and forest ecology. All the participants, kindly keep yourself muted throughout the entire call and your videos off throughout the webinar. And if you have any questions, please send them to me privately in the chat box, and we'll be addressing them towards the end of our webinar. With this, I'll introduce you to our esteemed panelists. We have Dr. Abi Tamim Vanak, who's a senior fellow and convener of Center for Biodiversity and Conservation at Ashoka Trust for Research in the Ecology and the Environment. And we have Dr. Farah Ishtiaq, who's a senior scientist at Tata Institute for Genetics and Society in STEM. And we have our public health expert, Dr. Prashanth Srinivas, who's the Assistant Director of Research at Institute of Public Health in Bangalore. Today, we'll be running a series of questions and answers and followed by questions from our participants. So to begin with, I would like to ask all the panelists, prior to we begin our discussions, I would like all the panelists to introduce themselves. Thank you.
Do you want me to go first?
Yeah, sure, please.
Hi, everyone. Good evening. Thanks for being here so late in the day. My name is Abi Vanak. As Anusha mentioned, I'm a faculty member at ATRI in Bangalore. I'm an animal ecologist by training, and nowadays I also masquerade as a One Health ecologist or a One Health scientist. What is One Health? We'll be talking about that a little bit more, but it's a very simple concept that says that human health is linked inextricably to both animal health as well as environmental health, and that for the betterment of human health, you have to view it in a more holistic way, by incorporating animal health and environmental health as key components. And this is only possible by having interdisciplinary approaches to understanding this problem, and having multiple groups of people or people across sectors collaborating to find solutions to issues that are viewed from a One Health perspective. This is especially true for zoonoses. Now, zoonoses are diseases that circulate from animals to humans, or that transmit from animals to humans, and they can do so via multiple pathways. They can do so directly, so an animal directly transferring a pathogen to a human. The most common example of which is rabies. So rabies is a good example of a pathogen that's transmitted directly via the bite of a rabid animal to a human. There are other kinds of zoonoses that require indirect pathways, where they may have come from an animal or wildlife origin, but then via an intermediate host reached humans. There is some evidence to suggest that COVID-19 or the SARS-CoV-2 virus is of zoonotic origin, and that its closest variants came from most likely from bats via some intermediate source, some intermediate animal. And then, of course, you have a whole range of diseases that are spread by vectors, things like insects, biting insects, mosquitoes, and Farah will be talking more about that as well. Ticks, mites, and so on. So all of these things, studying these diseases, of course, involves studying their animal hosts, but also studying the ecology of these of all of these hosts and their dynamics, and how it relates to the environment that they're in. Okay, does human activity increase the risk of the emergence of some of these diseases? This is a lot of what the conversation is going around nowadays. People are finally waking up to the idea that human activity adversely affects not just the environment, but also increases our own risk of contracting deadly diseases from the natural environment. So with that, I will end my introduction and give it back to Anusha. Thank you.
So let's move on to Dr. Farah Ishtiaq. Please introduce yourself.
Okay, thanks Anusha, and thanks Kriti and Center for Wildlife Studies for having us here. It's a very interesting and very important topic that we all are going to discuss in the next 1 hour. I'm a trained animal biologist, I'm an ecologist, and I've been studying ecology and behavior of different species of birds, mainly critically endangered species. But for the last 20 years, I've been studying malaria in birds in different systems in different parts of the world, just to understand how the disease, how the pathogen spreads. And this brings me to the question of the climate change, because malaria doesn't transmit itself. It's not an infectious disease. I mean, it needs a vector, a competent vector to transmit it from one host to the other. And that's where this issue of climate change becomes really important. And that's how it fits so well in the One Health umbrella, because with the climate change, there's going to be expansion in mosquito species or different vector species. And that's the model I've been using in different, high elevation birds to understand if there'll be a change in temperature, how the pathogens range expansion will happen, and what kind of vectors are involved in these dynamics. And in my current role with the ticks, we are mainly working on the human malaria system. And if I really look into our country in India, I mean, we are malaria endemic country. There are so many deaths that happen in humans because of human malaria. But from a disease ecology perspective, there is not much has been done. And that's what brings this vector ecology or population genetics into the mainstream, how this all going to pan out and what needs to be done. And that's what we are trying to tackle, both for really major diseases like malaria, for dengue, just to understand, what are the key vectors involved, what do we understand about their ecology, their niche overlap, their gene flow, and how the effective population size, and all kinds of questions that helps them in colonizing new species, basically at a landscape genetics level. So we are using different techniques and tools to understand, and maybe that can help us to mitigate at some point this disease aspect. Thanks, Anusha.
Thank you, Dr. Ishtiaq. Thank you so much. So we will move over to Prashanth, who is Assistant Director of Research at Institute of Public Health in Bangalore. Please introduce yourself.
Thanks, Anusha, and a very good evening to all of you who are listening in, and greetings, of course, to Farah and Abi, and thanks to the Center for Wildlife Studies for this opportunity for having this conversation. At the Institute of Public Health in Bangalore, I'm mainly involved in studies in what is called as health policy and health systems research. And I think the idea of health systems is a very important element when we look at One Health, because I think the idea of a conversation about One Health is to first acknowledge that many of the phenomena that we see are occurring within a wider system, even though we approach these problems with single discipline lenses that we all bring in. I mean, it's very possible to study COVID-19 or rabies or malaria, for example, from exclusively clinical medicine perspective, and you can have lot of knowledge that we can accumulate through research about the medical problems and manifestations and the clinical features of malaria, but very conveniently forget the entanglement of the problem of malaria with the kind of things that Farah was talking about why, for example, over decades and years, malaria patterns, the epidemiology of malaria shapes a certain way, and which kind of populations get affected and why not. So broadly, my area of work here is what we call health systems. And when we say health system, it's different from merely being about hospitals or diseases. We try to formulate our discipline around the entire system within which health and healthcare both get produced. And I think health and healthcare are often conflated one with the other. Healthcare is, of course, what we seek in a medical encounter, whereas health, as we know, is determined very broadly and ranging from genetic and biomedical aspects, the most important social aspects, where one lives, who one is, caste, gender, socioeconomic status, disability, all of these come into play when we use a systems lens, and that's what we try to do when we try to look at the health system. So that's basically my interest in public health, to look at health from a systemic view, especially from a social systems angle. And within today's conversation on One Health, I do some work on a zoonotic disease called Casanova forest disease, again focusing on trying to understand the system within which people who get Casanova forest disease, what makes some people more vulnerable to this as opposed to others, the behavioral risk factors, the geospatial kind of epidemiology, and also the wider health system actors who are responsible for responding to such pandemics. So in collaboration with ATRI and various other institutions, we have been involved for some time in understanding Casanova forest disease. And I'm looking forward to this very interdisciplinary conversation that CWS has set up.
Thank you, Prashanth. Thank you so much. Thank you, all the panelists. So let's begin this fabulous discussion. Let's start off with what actually One Health is. So all of you, kindly explain to our participants what is One Health and how did it start and what is it about? Abi, would you like to start?
Sure. So the idea of, as I mentioned earlier, and I suppose I gave the game away a little bit, or jumped the gun in my introduction. I already explained what One Health briefly is, but it came about. It's a concept that's not particularly new anymore. It's almost 2 decades old, and it came about through I think a conference that was organized by WCS and others. It was called One Medicine, One Health. As I explained earlier, the idea is simple enough on the face of it, that for better human health, you also need a healthy animals around you and a healthy planet. So the idea, of course, is to look at everything in a more interconnected manner, and to not look at everything only through disciplinary lens. And this is something, of course, that we've been, particularly in India, but across many other parts of the world, we've been battling with for a long time. Because if you look at our own health systems setup, it's very disciplinary. In fact, we have created islands of excellence. We have created these uber hyper specialist institutions, which tend to work in scientific vacuums, so to speak, not to even speak of social vacuums. So there are institutions that study or are hyper specialized, only look at virology, for instance. They go out into the field, get some samples, and then come and examine it in the lab. And those results are, of course, very important. I'm not dissing them. I'm saying all of this is very good, very important. But from its meaning for public health in particular, it has to fit back into that broader ecological context and into the broader social context. And this is where the hyper specialists sort of sometimes, or the institutions are sometimes out of, they are out at sea in some sense, because they don't know how to collaborate across disciplines, okay, and to work with people who come from different fields, who can bring in a different kind of understanding or a different lens to look at the same problem. And that's what One Health is trying to do. And we're really hoping that One Health in India really takes off. The government is making the right noises. There is a lot of push now for One Health in the last few years. You'll see lots of conferences have been organized. to push the concept of One Health, but there's a long way to go in actually getting different departments, getting different ministries, getting different institutions to start working with each other, to collaborate more. It'll happen. If we'll be forced to do it, because if COVID-19 doesn't teach us anything, it has to teach us this, that we have to work together to solve some of these intractable problems. And especially as Farah has said, in this changing climate, in this era of global change, these problems are going to become more frequent, and these challenges are going to look insurmountable if we don't look at it from a multidisciplinary perspective.
Very well put, Abi. Prashanth, would you like to add to that?
Yeah, I think I won't sort of duplicate or define One Health. I think the conversation has sufficiently already told us as to what One Health is. But I think one thing I want to bring up is, I feel that a lot of, there are many such paradigms. For example, One Health is not the only one. I mean, you have things like nowadays you have a bunch of scholars trying to put together the idea of planetary health, for example, and you have within the public health community, you have intersectoral action for health. So a lot of buzzwords coming in. I want to just sort of pick up one common thread in all of these, which is very important, which is to expand Abi brought in the idea of lenses. And I think a big problem of current hyper specialized disciplines has been that while the lenses they provide give us an amazing picture of the small, they lack the ability to see many other connectedness, the so-called the wider systemic issues. To give one example, I mean, rabies control. I mean, actually, Abi should be talking about this, but just it's a good example to understand why these expansion of these lenses is relevant for us. We can look at rabies as a medical public health, as a classical public health problem. And if we might have a lot of efforts at rabies control aimed at providing post-exposure prophylaxis. That means we ensure that vaccines are available at all primary health centers. We can train all the doctors, and we can also train pet owners to be responsible, etc. You can do all of this from a purely public health lens, but if we do not understand how the disease itself is being transmitted in the wild or domestic cycles, we'll keep on trying to, how do you say? I mean, it's a broken tank which we keep trying to fill. We need to understand the whole system within which rabies is coming, and that requires that public health people will have to work with ecologists, etc., etc. And you can pick up any of the so-called complex problems. There's also this school of thought of calling these as wicked problems. Problems that require us to relook at our lenses rather than do more research in the same kind of way. And I think all of these frameworks are asking us to deconstruct some of the lenses that we have narrowly defined and work with a wider range of actors. And I think One Health is one example of this kind of broadening of our lens.
Thank you, Prashanth. That was very insightful. Thank you so much. Farah, would you like to add to that?
Yes, I would like to add just briefly to that. So I totally agree with both Abi and Prashanth. And I also feel the same. I mean, what's going on now with the COVID actually is a combination of lots of problems, biodiversity loss and spillover of disease and everything. But in a nutshell, this is just not a scientist's problem or a doctor's problem. I mean, these all have become a social issues, right? I mean, disease have always been. So for example, if I'm working on a dengue ecology or a malaria, somebody asks me, look, you've been doing this work for so long, but nothing has happened. But it's just not my problem. People have to come forward and help in the process. And knowledge is power. So I think we need to bring in people from all different sectors, from interdisciplinary research to handle these kinds of issues now. And it's really, really very important. Tomorrow, if we are planning to launch, for example, a dengue study in Bangalore, to understand the habitat ecology for the mosquito. I don't want to do it as a scientist. I don't want just to have 4 researchers looking for that larval habitats. I want to involve citizen science to understand what they can contribute, because at the end of the day, they are the ones actually who are going to eradicate or mitigate the disease, not me. I can come and publish a paper, or a report about it. But really the onus lies on all of us to handle these issues now. So yeah, it's a social issue.
Very well said, Farah. Like, we definitely need interdisciplinary studies more. We need to engage citizens more in our science so that the conversation among the citizens and the science take place. And we can rectify problems, especially currently the pandemic going on. Everybody is the key, not just one single discipline. So with this, we move forward to our next question. What motivated you all to work towards interdisciplinarity or One Health? So Abi, would you like to answer first?
Sure. So, this basically gets to how I started my career as an ecologist. I was a typical wildlife biologist. For my PhD, I studied. I wanted to study the ecology of Indian foxes, and I went to, like most other wildlife biologists in India, I looked for an appropriate protected area to go and study them in. Even though they're common, they're everywhere, I could have just as well studied them outside protected areas. But as I was doing these studies of mine, I realized that more than foxes, I was seeing dogs in my camera traps when I was doing my initial thing. So that led me to think about what impact dogs might have on native carnivores, such as foxes, jungle cats, and so on. And then, of course, if there are so many dogs around, then there's a potential problem of disease risk for these carnivores. So that's what I started also investigating as a side project. So while I was doing these camps and I would go from village to village with my colleague who's a veterinarian, Anirudh Belsare. So he and I would go from village to village, hold camps for vaccination camps for these dogs. But they would bring their dogs in, and we would vaccinate them, but also take a blood sample to test for canine distemper virus, and also take a salivary swab to test for rabies. And one of the animals that a young boy happened to bring along was this, slightly agitated dog, but otherwise very normal looking. And I took a salivary swab and I tested it, and it was rabid. Okay, but you would look at this dog and not think that it was rabid, because most people only associate rabies with these really aggressive sort of animals. So eventually, the village veterinarian, I informed them, and then they took it into isolation. And that animal died. But then it made me realize that what a grave public, and this is basically when my whole thinking of rabies as a public health problem, or my interest in it, started awakening. I wanted to also then, I did a small project to try and understand how wild carnivores such as wolves and jackals what kind of role they play in rabies transmission. But more importantly, what is the public perception of such animals when they get rabid? Because you often see this. So India has some of the highest cases of rabies in the world. Most of this is dog transmitted, but there's a very small percentage, less than about 5%, that's transmitted by wild animals. And when a wild animal attacks people, especially a rabid animal, it gets a disproportionate amount of attention in the media. Dogs attack people all the time. It's barely even makes it in the news. So I wanted to see when wild animals attack people, especially rabid animals, how does this affect people's perception of this problem? And eventually, as I started trying to understand this issue more, I realized that we actually know very little about rabies dynamics in India. Most of what we know comes from other countries, comes from countries in Africa and and other Asian countries, and it does not necessarily apply to what we know, to the Indian situation. So as a person who's studying dogs, I immediately realized that, look, dog ecology in India is very different. So then I started collaborating with others, with other scientists, with veterinarians, with public health workers such as Prashanth, and with social scientists to understand what happens. With ecologists and veterinarians, we're looking at the disease aspect of it. With folks like Prashanth, we're trying to understand the public health axis of it. So, are vaccines easily available in public health centers in rural areas? Because that's where the majority of the problem is. With social scientists, we try to understand what is the health-seeking behavior of people in rural areas or even in urban areas if they get potentially exposed to a dog bite. Okay, what is the how much do people know about rabies in general? What is the pet ownership or people-dog relationship in terms of how much attention do they pay to things like vaccination of dogs? So these kinds of aspects really then allow you to have a better understanding of the ecology of rabies, also the socio-ecology of rabies. So, because of course, people are involved in here. So you have to approach it from multiple different sides, and which is what we've started doing. And this is where, the One Health framework, of course, comes in. This is where an interdisciplinary approach really helps in giving you a better idea of the bigger picture, and not just, you could always study dog cohorts, and you could look at epidemiology or seroepidemiology of rabies, and there's plenty of papers published on that. But to bring it all together is that's when you can start trying to understand the scope of the problem and start maybe then thinking of solutions, novel solutions, things that people have not thought of before, because now you suddenly have these novel insights that you previously wouldn't have if you only looked at everything through a very disciplinary lens. So this is my journey of interdisciplinarity. Of course, working in an institution like ATRES was rather helpful in that. So this is my story.
Very interesting, Avi. Very interesting to understand how rabies just kind of became an epiphany in your, research career. You ended up working in non-health systems. So, Farah, how about you?
Right, as Avi described his career, I also started just as a bird ecologist, studying the behavior and ecology. And I did a postdoc that was nearly 20 years ago, which was on avian malarial parasites, how they invaded, with introduced birds in Hawaiian Islands and led to extinction of a lot of native Hawaiian birds there. That was a life-changing experience for me, because even now, actually, whenever people talk about bird declines and extinction, disease ecology never comes up as a factor or even as a contributing factor. People talk about habitat loss, pollution, population density, all kinds of stuff. But with this climate change aspect, the disease never comes up. And that really made me think that what will happen in the habitat where, there are populations, there are birds which have never been exposed to any pathogens, how they will react with the invasion of these vectors and different parasites. And I also did actually a postdoc on avian influenza with WCS a while back in Mongolia to understand the H5N1 transmission with the migratory birds. And that really triggered my thinking that we got to do something in a country like ours, where you have so many diseases, we talk about like malaria, or we have H5N1 outbreaks as well. But I couldn't find anybody actually even looking, let alone talking about it, working on any of these kinds of aspects. And it's just completely neglected. So that really motivated me that maybe somebody needs to, so we should do and, come together and study these. So yeah, that's how I started working in India on the disease ecology aspect and taking malaria as one of the model systems in birds.
Fabulous. Sounds really wonderful. Prashanth, how about you? From public health to bringing all the disciplines together, how
Well,
was your journey to One Health?
I wish I had something to say in response to that. But I think for me, the primary interest has not been One Health actually. But my primary interest, even more than medicine and public health, was in birds. I started watching birds and enjoying nature and natural history fairly early on in my, I think, pre-university and while studying medicine. And so I think I've over time worked very closely with many people who work primarily on ecology and stuff. So to some extent, I think I got primed into their ways, their language, etc. So I think when the whole One Health framework came to me in a more academic space, which is much later, it was, I think, very easy. Not very easy. It was easier for me to be able to understand and see the linkages, probably because I had an interest in biology and natural history very much. So I think in some sense, I think there is that advantage that I have invested a lot of time reading about natural history and things like that. Secondly, I think perhaps is because I spent a long time in primary healthcare, and I always say this, that the problems that we see, actually many people at the grassroots in communities do not see them as separate. If you ask, for example, some of the people who I work with, I live and work out of a place called BR Hills. It's a tiger reserve 200 kilometers south of Bangalore. For them, it's not so difficult to imagine that livestock diseases and wildlife diseases and their illness are interconnected. But you go and speak to the, I'm just saying, health secretary or the wildlife department or forest principal conservator of for PCCF or something, there we need language to be able to, sort of bring them to the conversation that all of these are interconnected. So in some sense, I think being in primary healthcare and community settings, you also are able to see the interconnectedness of the social aspects of people's lives with ill health and with environment and things like that. I guess that was my journey into One Health.
Wonderful. I got to learn so much from all of you guys while working in the KFD project. So let's move on to our next question. Dr. Vanak, what are the challenges that we come across while conducting One Health studies, especially with the light of One Health and conditions of One Health in Indian scenario?
So these challenges, do stem fundamentally from the fact that people don't really know how to work with folks from other disciplines. We don't know enough of, it's, so as you'd have heard from all of these stories, most of us are interdisciplinary in ourselves, okay, in the sense that we've spanned multiple disciplines and therefore can now try and, we are in some sense trying to become jack of all trades, or jacks of all trades. But basically, there are folks who are very specialized, and for them to then try and view their own or do some of their own work, but bring in expertise from a different discipline to guide them, excuse me, is sometimes difficult. And those are some of the biggest challenges we've had, because people from, say, say with the Kyasanur Forest Disease Project, people who came from a very vector-borne diseases background, the entomologists, for instance, could not understand why we were looking for ticks in places where there were no ticks. Okay, they said, no, you're dragging in the wrong place. You need to, but this is an ecological way of sampling. Okay, we want to do representative sampling because you want to know which habitats are riskier than others. So the kind, some of these things, and then from from people like us who, especially wildlife biologists, who are used to handling animals without protective gear or without PPE, because I have a little bit of disease ecology training, which I took when I was doing my PhD. I was always careful about, and I would never go and pick up scat of an animal, but co-wildlife biologists will go and grab it with their hands, and this is something, and the lab people would look at this and be horrified, because that's not how you do it. You're potentially contaminating the sample, okay, or endangering your own life. You need to be protecting yourself as well. So there are some of these challenges when you're working across disciplines. With social scientists, of course, it's a completely different way. You learn how to interact with people. So these are all challenges, but these are also opportunities, because when working together as a team, it gives us an opportunity to learn from each other. Okay, and at the end of that, when at the end of our project, the KFD project, when the field work was over, there was a lot of complaining and grumpiness when the field work was going on. But at the end of it, everybody was like, "Oh, this was a fantastic experience. We got to learn so much," and it's a learning experience. It's a growing experience, and that is going to keep people in good stead going forward. Okay, and I think that's one of the greatest challenges. There are others. I mean, there are infrastructural challenges. And I'll leave that to maybe Farah and Prashanth might want to also talk about some of this stuff. But I think working with people from other disciplines, especially when there's that communication is not there fully, that's challenging, and that's something we'll have to change going forward.
All right, Abi, you brought back so many memories from the project. So moving on, Farah, how about, I would like to ask you, are our labs well equipped? Are they equipped enough to carry out such interdisciplinary studies from different disciplines, different scientists? Given I understand, like, not everybody has lab experience, but are we equipped enough?
Well, I mean, this is assuming that everybody is coming back to the lab to work, right? I mean, labs are designed to test for viruses. So people are trained to do certain kind of work. So I think the question you should be framing that, have we designed these studies which encompasses all interdisciplinary aspects? No, I think I would say no. I mean, even for something like COVID, which has taken off like a wildfire right now, I think the way the transmission dynamics are going on in the different parts of India, even with that, I mean, the screening process is very different. The kind of tests used are very different. I mean, you can't compare uniformly, even across different states. I mean, some states are doing better than the other. Maybe some states have better, people in place who are looking into the social aspects and doing better testing and using or be able to screen a lot of people versus the others. We do have a lot of infrastructure in India. I mean, don't get me wrong, we do. We do have a lot of trained people and manpower to test in the labs as well. That's not an issue. And as I see, I mean, there's so many of, we are doing rapid antigen tests, there'll be PCRs also done, more than a lot of developed countries have done so far. So I think that's something to be really proud of. I mean, for a country of our size. And they have come up with a very new test recently, which is called the Sfaluda test, which will be like a pregnancy test. That will be a life-changing or a revolutionary thing, if that comes into place. So all those things are coming forward. But in terms of interdisciplinary aspect, I think we need to make it more clear that what kind of support we are looking and how that needs to come across. Because as I said, again, knowledge is power. Just three basic things, for example, wearing mask, washing hands and something. Are people following? Me as a scientist can't be going around everywhere to pass on this message, but maybe there would be a sector of social scientists or public healthcare workers or other people on the ground who can, make this message much more clearer than somebody else. So yeah, I think we need more networking on that. Yeah.
Great. Thanks for that, Farah. Prashanth, in the light of public health, what all important aspects should be covered in One Health systems, and especially in studies which are One Health oriented?
Sure. While I respond to that, Anusha, could I just also build upon some things that Abi and Farah just
Oh, sure, please.
on the availability of, I mean, I thought Farah got that very well when she said, when you ask her about, are there enough labs? The idea is that do we only fix our problem with labs? We don't. I mean, for a social scientist, the lab is society, for example, and there's a lot of that. And we have a lot of problems there also. So I think if I look at just public health, I think we also lack the infrastructure there. You take a state like Karnataka, for example, we do not have enough institutions that even teach and train people in the discipline that is today very well recognized called public health. I mean, you can have a master's in economics, you have a master's in psychology, but you don't have good quality masters in public health programs in country. So what you have is, I can see that happening in ecology as well, that people often look for Western institutions. So they have to go there, get trained in what we only later realize is a slightly colonial flavored public health or whatever, ecology, etc., and then de-learn and deconstruct that. And only some of us are able to already do that. A lot others proceed with the colonized flavor, I guess. So there is that problem also to fix. So amidst a huge upsurge of Make in India and fairly kind of movement to feel a bit more nationalistic, I think what we haven't nationalized enough is a need for more institutions of this kind. Of public health institutions. I mean, each district in India is comparable to a country in many other places. We have 1 million to 2 million people in a district. Ideally, for understanding the health of 1 million or 2, you need, you may not need an entire university, but you still need a few people trained in public health who are constantly responding to local issues, who understand what are all the illnesses in that district and who are able to monitor patterns, the epidemiology, and advise accordingly to the government. And on the other hand, one is the lack of institutions who train. On the other hand, the few people who get trained in public health also do not have jobs. So during the midst of the COVID-19 pandemic, advertisements for public health positions in the state government rightly drew laughter, I think, because they were paying ridiculous amounts, ridiculously low salaries for people to work in as a district epidemiologists and state epidemiologists. So anyway, I'm going far away from our conversation on One Health, but I wanted to say that we need really to look at this much more comprehensively. We also have because a lot, if we as researchers together produce amazing research on One Health, who will consume this research? The research has to be consumed by the system. And is the system ready to integrate and practice the evidence that we generate? I'm afraid not, because you still do not have sufficiently trained public health cadres in state governments who are able to understand the language. I mean, it's not like, when I say understand, it's not like we are speaking highly sophisticated language, who just lack the training, I would say, to absorb this. So that therein lies the social complexity beyond the need for laboratories. Yeah.
Definitely, it's very important to include social aspects to interdisciplinary studies. That's definitely very, very important.
I'll just quickly add another. I'll in fact add an example to what Prashanth was just saying. So in our KFD project, the Casanova First Disease Project, we actually partnered with the Department of Health and Family Welfare Services in Karnataka, and they were from the get-go. They were partners of. So they were not passive receivers of knowledge. Okay, they were part of the co-production process of the knowledge that was being generated. And this is also very important. The research itself cannot, so that even if the research is interdisciplinary, the research itself cannot then be siloed or be, that should not create its own silo. Okay, because then there'll be a translation service needed for the research to be sent to the practitioners. Okay, but if you start involving but the practitioners and research groups come together from the beginning. So if you design your projects in that way. So this is what then happened with the KFD project, is that the outputs of the first models were immediately available for them to start acting on while the project was going on. Okay, so after we did the first year of fieldwork, we generated some data, we generated some models, and that helped them then target vaccination for the next year. Okay, and that helps, that also helped us sort of validate some of those models to see where the new outbreaks were occurring, because we were partnering very closely with the people who are on the ground. And so that's why the disciplinary lens should also include intersectorality. Okay, so it's not just the research sector, but also the practitioner sector, the policymakers also need to be involved in this. And that's really the only way we can start sort of bridging these gaps. Some of these gaps are deep chasms, and we'll have to have some strong bridges being built there to overcome this. But it's possible. It's not out of reach.
Can I add to that?
Yeah, sure.
So yeah, I mean, that's quite right. I mean, I also feel that when people should come forward and do a lot of research which involves interdisciplinary aspect and also the disease ecology aspect as well. This should be something encouraged, when we write proposal, which should have multidisciplinary teams on that. Because one of the problems as an ecologist, I mean, I can be really focused. I mean, it takes long-term data set to show a pattern sometimes to converge. And we don't have that much of time or even funding to proceed. But maybe some particular aspect of the research, which as a social scientist or a public health researcher or a scientist can look at, and if we can produce those, that would be really beneficial for the project. I mean, that's why this multidisciplinary research is really, really important. Yeah.
Great. Thank you all. Thank you so much. With this, we have reached to the end of our discussion. And just to end it, I would just like to ask one question to all of you. Is One Health enough given COVID is happening? Is it enough to assess it? Is it enough to minimize the impact? And how do we ensure to minimize future outbreaks? Abi, would you like to go first?
Okay, you're always putting me on the spot first, but look, it's a tool. One Health is a framework, and there'll be other frameworks. Prashanth already mentioned this, the Planetary Health framework. To me, Planetary Health is something that works at global levels in terms of its, there are planetary boundaries set for, say, for example, carbon dioxide level emissions or nitrogen that we're using, or phosphorus, or all of these things. And meeting those boundaries requires global action. One Health has the advantage of being scale independent, in the sense that it can work at very local scales, and you can also have a top-down framework that encourages the working at those local scales. And there could be other frameworks that are coming up as well. So it's just, I think it's just a tool. It's a framework. There'll be others that may be better. Already there are some criticisms of One Health as being too technocratic, in the sense that there's too much emphasis on the surveillance part of it and not enough on the social aspects of it, and how it can in fact be used in some cases to hide underlying concerns. So, for example, there's a lot of emphasis being put nowadays on viral discovery. Okay, and it's important, of course, but a lot of health problems, or the public health problems, can be solved by strengthening basic public health infrastructure. Okay, at village levels, at panchayat levels, at district levels. How do people have access to good, again, clean drinking water, all of our SDGs that we talk about. These basic things might, can actually ameliorate a lot of the other problems that are likely to arise. And these can, of course, be done from a One Health perspective, and it's all good. Um, uh, but let's not also become too technocratic with that itself. So let's not just say, oh, we need bigger labs, bigger diagnostic facilities, more BSL-3, BSL-4 facilities. No, yes, we do need them, but we also need a lot of work being done at the local level. Yeah.
How about you, Prashanth? What would you like to add to this?
Yeah, just listening to Abi, and one thing comes to my mind. It has been said in a way differently, maybe, but a hammer is only as good as the one who wields it. So it depends on what we do with the One Health hammer. we can wreak a lot of damage also with it. To give a better example, One Health is also, it is not so new, but it's also, a developing discipline. It will only develop as well as we research and implement the community develop it. We can also do the yesterday kind of non-One Health stuff in a One Health frame, maybe find a better publication because, One Health is there. We can do that kind of stuff. Or you can also use the framework to really expand the way we were doing things yesterday. So it really requires, I think, a consciousness raising amongst us than what the tool itself brings to us. And I think Abi put it very well. There's still a lot of problems that One Health will not fix. You don't need One Health approach to fix drinking water and sanitation, which is an important determinant of why children die in the country. 75% of children under 5 until several years back were anemic. And the treatment for anemia has been discovered a few hundreds of years ago that, in our foods. So there are various other problems as well in food systems, in our sanitation systems, etc. So we need to look at One Health in that perspective and, wield it that way is what I would say.
Great things, Prashanth. Farah, how would you like to conclude our session?
Well, I just want to add to what Abi and Prashanth was saying for the One Health. I agree. It cannot solve everything. It's just a concept or framework, whichever way you want to look at it. But I guess it's a great opportunity to bring a lot of people from different disciplines on one page, right? I can just go about talking about my research, but here I can involve a lot of people from different disciplines. And I think that's how I would like to look at whether it translates actually, it's an opportunity I can push for it. And going back to the point of which Abi was saying, the surveillance emphasis has been there, which I agree. But look at this way. We had this Nipah outbreak, right? A couple of years back in Kerala. The only way they control it because there was a very good surveillance and an infrastructure. I'm not saying from the lab point of view, there was a lot of public awareness. There were a lot of parties involved and they managed to contain it. And the large part of that, the awareness part, and it was done really nicely, So I take that as a very good example. Look at in Bangladesh, there have been so many outbreaks going on for all kinds of reasons for the Nipah. So I think there is a lot of hope in the One Health framework and to work, and may not be work for all the diseases, for all the problems, but we can still solve a lot of issues with that. Yeah.
Definitely. Thank you so much, Farah. Thank you, Abi. Thank you, Prashanth. Now we'll be taking some questions from the audience. We have a question which says by Sandeep. How is India developed, or how One Health is developed in India? And do we have separate departments in colleges other than, veterinary institutes and MBBS colleges? Who would like to answer this?
I can go, and I would like to say, I think the idea of One Health is to go away from departments. And actually, okay, let me not frame it that way. Actually, any department or many departments can do One Health, and that's, I think, what Farah was trying to bring a bit more of optimism from where I was saying. So I think the power of One Health, I guess, is that if I list the department, it could be Department of Medicine, it could be various veterinary public health departments can have One Health. It can also, you can have One Health departments potentially in sociology and other departments. We haven't yet reached that day, but that can happen. So I think that's really the idea of One Health, and not to have a separate department.
All right. All right. So we move on to the next question. It's again by Sandeep. Can't citizen science help in developing public health and One Health awareness in our country? Abi, how would you like to answer this question?
I'll pass it over to Farah because I think she's actually doing citizen science.
Yes, yeah, if I may answer that. So yeah, yes, I mean, I know this is a very big optimistic effort from our end, but I think we can. So for example, I mean, as I was saying earlier, that dengue is a huge problem. I mean, Karnataka topped the dengue cases in southern India, and so is Bangalore. And we are going to launch this citizen science-based, survey for dengue. I mean, we have fantastic data from BBMP. It can tell you, year-wise incidence for the dengue. But how does that translate to the mosquito habitat? Of course, people can say there are more mosquitoes here and there, but mosquitoes just don't appear on their own, right? They have got to be some kind of habitat and of course, temperature and other kind of factors which plays a role. But this is where the people support comes into play, because a lot of habitat change has happened. Urbanization has taken place. So me as a scientist can go and just write about it, but I want to involve people, in surveying and understanding the process, how they can help and what change they can bring that can reduce the number of cases or even make it disappear in the future. And I think this can work really well. If nothing else, definitely for dengue, it can work in Bangalore, or for other cities in India. That's what I believe, yeah. Does that answer your question? I hope so.
Yeah, I'll give you another quick example also. It's a combination of technology, civil society, and citizen reporting. So in Pune city, I work with this really wonderful NGO called Rescue Charitable Trust, who run a animal hospital and facility. They bring in sick and injured animals, and they developed a platform which allows citizens to report sick or injured animals on the streets. And so we partnered with them to start doing rabies surveillance in Pune city. And it was eye-opening, because all of these years, even though they have been getting a lot of animals that they suspected were rabid, but we just sort of helped them get some kits for testing, and then we took the samples and tested it, brought them back to Bangalore and got those tested as well. And suddenly we find out that rabies numbers in Pune city are through the roof. And this allowed them to rapidly be able to tell people in the community if a rabid dog was caught from that area. So the feedback loop was there. And then, awareness messages were spread to the people who were in that community or in that locality. Or if somebody was bitten by that dog, then immediately they were asked to go and get the proper vaccination and so on. So this allows a feedback loop, a real-time feedback loop, to happen, especially when lives are at stake. So these kinds of partnerships are very important, and this is just an example.
All right. Thank you, Abi. Thank you, Farah, for answering the questions. We have reached our time limit and we have finished our webinar well in time. Thank you, everybody, for coming and taking time out to listen to us. And thank you all the panelists for bringing on this wonderful, fabulous discussion, highlighting the importance of One Health in India and how the interdisciplinary approach in India can battle COVID. Thank you all. Have a good evening. And if all the other participants, if you have any other questions, please email to us outreach@cwsindia.org, and you can contact Prashanth, Farah, and Abi individually as well. Thank you, everyone.
Thank you. Thank you, Farah. Thanks.